Where did the pain scale come from? Did you know that pain scale was actually never intended for your doctor to help diagnose you at all? It was actually originally made for clinical trials to assess treatments at the end. And in the early 2000s, hospitals and clinics decided, well, it's better than nothing. But the problem is, pain is relative. And a number just doesn't tell them anything they need for diagnosis. Now, this isn't necessarily the case for ERs. ERs use it in a different way because they're an in and out kind of a place. And so before I go into the exact meaning of each number on the scale, I'm going to let fellow YouTuber, I believe it's SteveIOE, I'll put it over here. I'm going to let Steve explain exactly how the pain scale is used in ERs. All right, take it away, SteveIOE.
Tips from the ER. Pain scale, 1 to 10.
Why do we ask you what your pain is on a scale of 1 to 10 when you come into the ER? This number helps us document whether or not our treatment is helping you. If you come into the ER with 9 out of 10 hand pain because your girlfriend slammed a car door on it when she found out you were cheating on her with her grandma, we will document 9 out of 10 hand pain, and then proceed to bring that number down with some pain medication. Hopefully we can get that number closer to a 3 out of 10 and document that so that when some legal person looks at your chart to see if we were actually doing our job, they will see that we did everything we could to make your feel better.
Now, 10 out of 10 to 3 out of 10 shows improvement. That's all they need to do to show they did their job, basically. Let's go through the pain scale. So when I worked in the hospital, this was the pain scale we used. Lovely, isn't it? So as I worked there, I was told 10 is basically a fainted patient because of the pain, and 0 is no pain. And somehow the numbers in between are in between. So by that reasoning, we were literally told anyone that says 10 out of 10 is faking it or drug seeking, which is not true. It's really annoying because even if you look at the pain charts between hospitals, they aren't the same. The pain chart from myhealth.alberta is completely different than the pain chart from the Veterans Affairs hospitals. And that makes it really confusing for people working with it, for the patients working with it. The fact that every patient's tolerance of pain is completely different, especially for those of us with fibromyalgia and stuff. What we consider like a 4 or a 5, which is like, we can live with it. It's really bad, but we can like live with it. Other people would probably consider an 11 or a 20 because they're not used to being in pain all the time. So it's all relative, you know. The only time I do think it would work is, like Steve said, with the ER, so they can gauge progress from start of the appointment to end of the appointment. That's about the only place I think the pain scale makes sense, or at the beginning of a clinical trial and at the end of a clinical trial. Again, to gauge progress. But when they ask you every time you come in for a doctor's appointment, like they do with me, what's your pain rating? I gotta be like, okay, do you mean what I think it is, what normal people would rate it as, what it is the most of the time, what it is right now, what it is in this area versus this area? It doesn't really work for diagnosis at all. So this was actually causing me a ton of problems as I was trying to go through all the motions with the doctors and get as much files and paperwork and diagnoses as possible. And that kept being an issue because I'd ask the doctor, I'd be like, well, what does the number mean to you? It's not only what I consider the number, it's what the doctor considers the number, what the nurse considers the number. And none of it really works. And so I have to ask this every time to every doctor. They don't document that. So if another doctor looks at this number, they're going to take that a different way. It was just so frustrating.
I just hate it how so many doctors are so self-centered, you know?
I did learn very quickly to gauge my pain as though I were a normie. And by that I mean, okay, my back is killing me right now. And I have a high pain tolerance. So from what the chart says on the chart, I probably rate it like a 4, like I can handle it, I can still do this. I also am used to being in a crap load of pain. So a normal person would rate this 9 out of 10. They'd be probably crying, screaming. And so what I started doing was rating things about what a normal person would rate it, maybe -1. So I'll tell them an 8, and I'll be like, it's really bad, and I'll try and say it from the perspective of a normal human.
I am normal.
And even with talking through it, I always made sure to add more context though. And I'll talk about that when I get into ways to instead explain your pain later in the video. And it really did end up working for me over the years. But I first want to go into, so many of us, we don't want to be considered a pain pill seeker, that we underrate our pain. We make it harder on ourselves because then no one believes you because you're rating it too low. If you're always underrepresenting it, they're not going to think you're as bad as you are, and you're not going to get the help you need. You just aren't. I mean, if someone goes in, with a normal headache and they say that's a 4 or a 5, and you have severe back pain that makes it hard to walk, and you're saying it's a 4, hello? Think about that. They're not going to think you're a drug seeker unless you're specifically asking for pain pills. But if you're trying to get a diagnosis, if you're trying to get tests, if you're trying to do that thing and pain pills are a byproduct, don't worry about it. Now, when I was working in the hospitals, we hated the pain chart. We thought it was so stupid. It really didn't make any sense. It wasn't helpful. It was just something you were forced to do. And honestly, I'm surprised it's still around because it is really ineffective for diagnosis, and that's the way they're using it in most cases. And then you get the jerk doctors and nurses. There are a lot of jerk doctors and nurses out there that will always treat you as a drug seeker. They will always have a hard time believing your pain. But that doesn't mean you should change to lessen it. By lessening it, you're not going to help yourself in any way. You are only going to make them think, yeah, they were right about you. Yeah, it's not that bad. You're just a baby. Or you're just drug seeking. It's not going to help you in any way to do that. They're not going to think any better of you. It's not going to change anything.
Playing macaroni was much more fun than dealing with a hypochondriac.
I have issues with pain medicine. I'm on low-dose Naltrexone now for my fibromyalgia, from all my inflammation, pain, and everything. It works really good. I'm going to make a video on it eventually when my brain works well enough to do it. So Naltrexone is normally used for people getting off drugs and stuff. And the low dose wouldn't work for that, but there are nurses and doctors that will see that, instantly judge me and treat me as though I am a drug addict.
Yeah, I'm a huge drug-pushing drug guy.
I have literally never, if they bothered to look at my history at all, they'd see I have issues with all that, and I won't take that stuff. They just instantly judge, though, and they do treat you really badly. Don't put up with it. Report them. Go to a different doctor. If your nurse is acting that way, tell the staff. Report them. That is not cool. But yeah, there's not much you can do when they're just jerks. And there are always jerks in every profession.
You're a jerk.
So some ways instead you can use to try and explain your pain to doctors to help better them understand how to diagnose you. So the first thing I've already kind of said earlier is use the pain scale as if you were a normie. Just don't over exaggerate, but literally think how a normal human being that never experiences pain hardly at all in their life would rate this at. And that's what you rate it at. Maybe not, maybe -1 if it's a little too high. Now, what's really worked for me is I started keeping a pain diary, and I started documenting when the pain was, the date, the time, and what it was stopping me from doing, what it was preventing me from, how it was impacting my life. Because this is something that is very important in healthcare, at least when I was working in healthcare. It's been a little bit. The main thing you're trying to fix is you want the patient to have a good quality of life. You want their quality of life to get better. So if you know the pain is affecting their quality of life in these ways, you know that's how you have to fix it. And it also helps if you know the pain is preventing them from doing walking or certain things like that. You kind of know what direction to go in based on where it is and how it's affecting them. You know what type of tests to look into next. And it also, when you apply for disability, very important, very helpful, FYI. And then also in this pain diary, make sure you document things that make you feel better or worse. Very important to note those things out because that's really important for you as well, because you want to be keeping track of all this so you know in the future how to pace yourself and how to prevent your own flare-ups, because you will pace yourself and you will make sure not to do those things that cause you to get worse, which you might not have noticed if you hadn't been hyper vigilant and writing them down. And another thing I would write is literally how you are living with the pain. I had a hard time writing it out, and so I made more of like a visual system that was like obvious what it meant. Some things I wrote out, some things I did the faces, and I used a calendar. I didn't write it in like a diary. I used an actual calendar with the big squares, and I wrote it in each day, what I did, how it affected me, end of the day, face, and that worked really well. By the way, if you're thinking this video is a smiley face, make sure to like and subscribe. It's free for you, and I would really appreciate it. You sharing these details with your doctor will really help paint a better picture of what your life is like with the pain, and really, it should ensure you to get the best treatment possible and a proper diagnosis. That is, unless you get on your doctor's bad side. But if you watch this video on the 7 things doctors hate patients doing, you shouldn't have a problem getting along at all. I hope this video is helpful to you. Please share it and make it go viral, and keep on surviving.